Good morning, everyone, and welcome to today's PHO webinar presentation, Infection Prevention and Control, Orientation for IPAC Leads in Long-Term Care. And today's subject is Occupational Health and Safety. This session is the last session of series of 6 sessions we offered during last few weeks. My name is Boris Marufov, and I am the team lead in IPAC PHO and have my pleasure of moderating this session today. And before we begin today's presentation, I will mention a few housekeeping items. The chat pod has been disabled to limit any distractions during the presentation. Please use Q&A pod on the bottom of your screen. If you have any questions during this session, a discussion and question period will follow at the end of the presentation. Presentation slides and the recordings will be available in about 2 weeks from today's session. And if you have any questions during this session at any point or experience any technical issues, please email at capacitybuilding@oahpp.ca. So now it's my pleasure to introduce today's speakers, and it is Laurie Schatzler and Dariusz Pajak. And you might be familiar with them already from previous sessions. Laurie Schatzler is an IPAC specialist in Public Health Ontario with background in acute care, primary care, and public health sectors. Laurie has maintained her certification in infection prevention and control and occupational health nursing and brings these areas of expertise to her current role in PHO. Dariusz Pajak is an IPAC specialist in Public Health Ontario as well. Previously, Dariusz spent 15 years in both acute care and long-term care settings, focusing on infection prevention and control, as well as local public health. Dariusz holds credentials in infection prevention and control in epidemiology and public health, and is a former member of Provincial Infectious Diseases Advisory Committee. And now I will ask Dariusz to begin the presentation.
Perfect. Thank you so much, Boris, and good morning, everyone. Thank you for joining us for this final session in this series. As mentioned, today's topic is Occupational Health and Safety, also known as OHS. And for today's topic, some of you may be a little bit puzzled as to why we are covering occupational health safety in an IPAC webinar. But the reality is preventing and controlling infections is done for everyone's benefit within a long-term care home. This obviously includes the residents, visitors, but certainly staff are part of those individuals in the home that we want to make sure we prevent infections for, just because of the direct association and contact with residents who may be ill themselves. As the IPAC lead, it's important for you to have a good sense of what an occupational health and safety program does and what it entails. You certainly don't need to have a ton of detail unless you are actually overseeing OHS as part of your role, but you certainly do require a good grounding in the subject itself. To this point, you can see on this slide, we will be covering a few objectives for this session, including identifying the essential elements and key components of an OHS program, which is very important. We'll also be highlighting the importance of working collaboratively with occupational health and safety. This is especially important as IPAC and OHS share many goals, as you could imagine. And finally, my colleague Laurie will go over a few communicable diseases of OHS interest and talk about the use of indicators for OHS programs. Here's the agenda for today's session. We will shortly touch on the second item, the IPAC Lead Orientation Checklist, which has been highlighted during previous sessions, so some of you may recognize that. However, most of our time will be spent on the subject of OHS itself. And finally, you will have an opportunity to ask some questions, and we'll also look for some feedback, because it's very important that we ensure that what we're presenting and what we're providing you with is meeting expectations. So for those who have attended the previous sessions, I mentioned we already highlighted this resource. It's the orientation checklist, and it's essentially a roadmap, sort of a guide for growth and development as an IPAC lead in your home. This resource is now posted on a dedicated web page of the PHO website, where you could find additional resources. So there's resources from PIDAC, from best practice documents there as well, that are related to your area of focus. As well, the webinars that you've been viewing, including this one, will be posted on that website as well. I believe 2 of them are already there, so the other ones will be added shortly. For those who have some experience in IPAC, I would actually still strongly suggest that despite of this resource being called an orientation checklist or manual to an extent, it's still important that those who have more experience with IPAC continue to review and use this as a guide, only simply because you could use it as a self-assessment tool where you could basically see where you are in your professional development as an IPAC lead. And maybe it could highlight some areas where you may need some additional resources, or you may need to strengthen. Perhaps surveillance is not your strong suit. Maybe construction-related elements, which we covered, I believe, in the last session. Maybe that's something you would like to work on a bit more. So we certainly encourage everyone to look at this resource and see where you are in your current practice. And now we'll move into covering some of the core materials for the session. So as you're aware, OHS is an important field, and there's a lot of legislation in place to ensure workplace safety. All of us have to some extent been exposed to OHS, primarily because by working in healthcare, everyone has interactions with the OHS department during your job onboarding process. So that's really important, and we will touch on that shortly. In terms of applicable legislation, you could see there on the slide, the overarching legislation that applies to all provincially governed workplaces really is the Occupational Health and Safety Act. Under this act, however, you will find a lot of specific regulations to certainly cover some of the workplaces that have unique challenges. And the healthcare sector in particular, as well as residential care facilities, are examples of areas of focus that really need specific, unique legislation just to kind of cover the unique challenges that we do face in these sectors. So needle stick injuries, for example, are legislated requirements that are in specific regulations, as are biological agents, so those are covered as well. And familiar with, to most of you, is personal protective equipment. So that certainly is something that occupational health and safety legislation would be covering. Some acts, such as the Long-Term Care Homes Act and the revised editions of those pieces of legislation, actually have OHS elements of practice embedded in those legislative documents in particular. So that's certainly something you would like to review and make sure you're aware of those. Speaking of legislation, one important legal concept is that of due diligence. So acts and regulations, like we just covered, they certainly provide general frameworks and requirements, but there's certainly additional guidelines and best practice documents out there. And although these aren't specifically legislated, we still need to have compliance with these, just because we want to make sure that your home is doing everything that would be reasonably expected to keep staff safe, for example. Including, as an example, the development of quality improvement plans and other measures to ensure compliance with all these best practices that are highlighted here. The slide shows some examples of protocol and guidance as well. One is the Ontario Hospital and Medical Association protocols. So although these mention hospital in the title, these are equally applicable to long-term care homes, and are really an excellent resource and are freely and easily accessible online. So you could certainly look at those, and I believe Lori will be looking at those and highlighting some elements of those a little bit later. But these are updated routinely, so you want to make sure that you keep abreast of the changes. I believe it's every 2 years for the OHM and OHA documents, but certainly, as you could imagine, with things like pandemics, there's more frequent updates as things kind of develop. Many of you are familiar with the series of PIDAC documents. Obviously, this session is hosted by Public Health Ontario, and we do have the PIDAC documents on our website. These documents, as mentioned, are available, and they too are routinely reviewed and updated to make sure that they are current. They do kind of cover a broad swath of the healthcare sector, so they apply to acute and non-acute settings. And all healthcare practitioners, especially those in IPAC, do need to be aware of those. There's also resources there that are occupational health and safety in focus. There's a document I'm sure some of you may have come across, as focuses on occupational contact dermatitis, for example. And the IPAC connection there is obviously with hand hygiene compliance. So obviously hand care, hand skin quality is very important to ensure that there's compliance with hand hygiene. So all these things kind of work in tandem. So in terms of your role in OHS as an IPAC lead, it's important that you're aware of the relevant OHS policies, such as not working while ill, and the various protocols that must be followed, like reporting illnesses, obtaining clearance to return to work, for example, and so on. The reason for this is that staff will often rely on IPAC staff for such information. This is especially true because, as you could imagine, you are more likely to encounter staff that work in IPAC during your routine day-to-day activities. So IPAC staff are certainly on inpatient or resident care units. They're there to gather information, review cases, and all that, all those scenarios. So you want to make sure that as an IPAC lead, you have some of this information to share because you will be acting as a resource on a routine basis to an extent. Importantly, by being aware of these policies, you also ensure that there's consistency in messaging, whereby OHS and IPAC are on the same page. And also there's an opportunity for collaboratively promoting things like the healthy workplace policy through education. That just shows some of the collaboration that these departments do ongoingly, as well as the need to kind of be on the same page. The added benefit to knowing relevant OHS policies, especially with an IPAC focus, will allow you to provide better rationale. So it's certainly important because that could potentially improve compliance by ensuring that staff understand kind of the reasons behind things. All of us being professionals, it's a lot better to give people a justifiable reason than just telling them you must do this. So if there's a lack of compliance, it's occasionally based on simply staff not understanding rather than caring. So it's important to have that rationale so people realize why certain approaches are beneficial based on a scientific kind of evidence-based approach to what we're trying to convey. Ultimately, it is important that policies are clear and available to all staff. Certainly, if we expect staff to follow policies, we have to make sure that that's the case, and that there's awareness surrounding their application, and that their application is easy, and kind of making sure that if we expect application and people to follow the policies, that we are simplifying the process, and that the steps that are required are very much salient to staff and promoted. Staff orientation is an important period, I guess, when education does take place, and that is definitely the same for Occupational Health and Safety and IPAC during orientation. However, it's just the first step because we want to make sure that you recognize that training is specialized for a lot of staff groups within these settings. So you want to make sure that you do provide refreshers, internal recertification opportunities, whether it's to modules or in-person sessions, and that covers everything from compliance and policies and protocols and what the expectations really are. But the reason we have to kind of address the unique challenges of different staff groups is that some staff may have roles that are a lot more involved. So, for example, if there's a staff member who provides direct patient care, dressing changes, there's certainly a lot more that has to be reviewed in terms of policies and procedures and compliance requirements than someone who may have a role such as providing environmental cleaning or things of that nature. So it's important to kind of modulate how we educate based on the risk that individual roles kind of have as part of that day-to-day operation. When speaking about policies, protocols, and education, and so on, it is important that all of this is fostering a collaborative relationship with OHS because establishing that relationship is really important so we can make sure that there's clean communication and that expectations are clear. Communication and collaboration is especially important just because, again, as mentioned, there's a lot of overlap between IPAC and Occupational Health and Safety. So it's really important to not only take advantage of that and work collaboratively, but the key there is to eliminate any potential for duplication, or sometimes what I've encountered, and worse yet, is actually mixed messages. So you certainly don't want to say one thing while Occupational Health and Safety policies may potentially contradict things. So that's especially important because, again, there's a lot of common themes or elements, especially when it comes to OHS and IPAC-centered themes within that portfolio. So you want to make sure that those are clear. As you can see on this slide, there's two examples of a shared topic. So immunization campaigns and respiratory fit testing. So there are certainly things you could collaborate. And for some of you, obviously, you're wearing both hats. So it's something that would kind of you could look at from both lenses, and you could present on from both kind of sides of the same coin to an extent. Considering homes are likely to have very small or single person IPAC departments, as just mentioned, that's certainly something that you could work collaboratively with. And if there's two individuals doing the role, certainly working together will kind of ease the burden and make it a lot more seamless and simple. So next, we have 3 slides or so, and in these slides, we will be covering key components that make up an occupational health and safety program. Again, the idea here is to kind of not make you an OHS lead, because certainly you are an IPAC lead, and for those who are covering both areas of practice, you certainly would have to get additional training, but just to give you a general overview of what OHS involves. So the first element, and we've sort of touched this already through the OHA and OMA protocols that we mentioned, is medical evaluation. So OHS protocols and programs are responsible for the pre-placement clearance of new staff. And this includes assessing the staff for risk, establishing an inventory of up-to-date immunizations, and also determining tuberculosis skin test status, which is something Lori will touch on in a bit. The health inventory should also contain a staff member's history of predisposing conditions that puts them at increased risk, as this can further guide immunization requirements, post-exposure management, and potentially work assignments. So obviously everyone has different risks that they bring with them, so you want to make sure that that's accounted for during the OHS assessment. The second element of OHS programs is that of education. We mentioned legal requirements and best practices, but you want to make certain that staff are not only aware of the requirements outlined in a clear, accessible policy, but they're also familiar with the protocols themselves that they must follow. Again, an example of this is the healthy workplace policy. Just as you would do with IPAC and OHS education, again, like mentioned earlier, you want to make sure that you do tailor your approaches. There's certainly some fundamental basics that all staff need to understand, such as routine practices for IPAC example. So there's similar things that all staff would have to understand. For example, WMIS training, that would be something university required for all staff. But again, as mentioned, there's some staff based on the role that have increased risk. So they may require additional things, such as, for example, mask fit testing and guidance on how to properly don and doff masks and safe disposal of sharps. So again, those are additional requirements that staff that have a clinical focus would need to know, and that's where education and policies would need to be adjusted. And the orientation, those program education components are where you kind of expose staff to those expectations to an extent. For example, education of registered healthcare professionals would be more involved, as mentioned. And equally important would be a risk assessment to make sure that you clearly are able to identify and kind of communicate the risk to the individual staff member, just so they kind of are able to frame what they're doing and be able to properly kind of identify the risks through a day-to-day role, just like you would do with IPAC when you perform risk assessments to see what PPE you require or what other elements you require of practice to make sure that you're safe based on that risk assessment. So that also goes for occupational health and safety. So again, this kind of highlights the overlap between the two professions, but even though they may be unique, but certainly there's a lot of opportunity to collaborate. You certainly cannot assume everyone understands this information, which is why you want to make sure that it's relayed. So the third component is immunization. We're all quite familiar with this, I'm sure. Apart from the annual immunization that's done for influenza, for example, we've all had our primary series and boosters for COVID. And I'm sure most of you don't need to be convinced of the benefits of immunization, but it's certainly something that needs to be promoted to staff to make sure that there is good compliance. After all, the protection immunization provides is twofold. So we're not only concerned about the staff themselves, which is obviously very important, but in a healthcare setting, there's the IPAC consideration, which is the risk of transmission to others. And that's just not residents, but also colleagues, visitors, and anyone else who could be in a healthcare setting. This is especially important when working in healthcare because, again, mentioning residents, they are a vulnerable segment of the population. And even though they may be immunized because they are older, their immune system is different, they may not be translating the vaccine as effectively, which is why we want to make sure that there is a concerted effort through immunization to protect everyone in the home. But also, again, our colleagues and others who are susceptible within that setting. Apart from preventing transmission, immunization programs can effectively prevent work restrictions after exposures, and that's quite important. They also have impacts on outbreaks and duration of outbreaks. Some of you may have experience for influenza, for example. Often when there's an influenza outbreak, once everyone gets there is immunized, and also there's prophylactic treatment that's given, the outbreaks stop quite suddenly right afterwards. So there's a lot of benefit to this. So for those who are immunized, you may be able to work following exposure, for example. And the concern there is for staff who aren't immunized and would need to be furloughed from work. And that's significant because depending on the organism, depending on the type of infection, that can range from weeks, from 11 days to several weeks. And that's definitely concerning, especially when you're looking at staffing challenges and other things. I'm sure everyone could recall that during the pandemic, that was a huge incident. And I'm sure most of you can't even imagine if staff members had to be off for several weeks. During the pandemic, there was a huge impact on operational needs when staff had to be off for several days. So again, being off for weeks would certainly have significant challenges for the organization from an operations perspective, coverage, and ultimately costs, which is why immunization programs are very effective and promoted because they do have a lot of cost savings associated with them. Even certain vaccines that are not covered by the government are actually worth considering. So that's something you would want to bring up during your meetings for occupational health and safety, especially if the vaccine is seen as preventing transmission, reducing need for treatment, eliminating exposures, and of course, eliminating outbreaks or preventing outbreaks, because outbreaks themselves, as many of you have seen during this pandemic, can have devastating consequences. So putting a stop to the outbreaks before they even begin, or eliminating the potential for outbreaks, is certainly something that we should all strive for. One thing worth touching on is mandatory versus voluntary immunization programs. Mandatory is certainly easier, as you could imagine. Compliance being required, non-compliance obviously makes it a lot easier because there's consequences that you could impose for those who do not comply. However, most programs are voluntary in nature, and therefore they do rely on a lot of education, as mentioned earlier, making sure that staff are making the informed decisions and that they're aware of the risks and also the benefits of all this, including the risk of transmission to others like our residents, our colleagues. But working with occupational health in concert collaboratively to promote immunizations effectively is very important, and doing so will prevent all these things that we've mentioned. In terms of knowing what vaccines to recommend, so a lot of you may be concerned about that. What do we include in our policies? What do we focus on? So on the screen, you could see on the slide there's the National Advisory Committee on Immunization. Many of you may know them as NACI. So they have developed a Canadian immunization guide, and within that guide, there's actually a specific section that addresses recommendations and indications for immunization for healthcare workers in particular. So definitely something you want to reference. And with collaboration, I've mentioned that multiple times, there's also collaboration that could be done outside of IPAC or outside of your facility by collaborating with other occupational health professionals, as we would do through communities of practice and all these other approaches. Our fourth component of an OHS program that we'll cover is management of occupational illness and exposure. So some of this we touched on with immunization, but where indicated, it's crucial those with potential exposures are assessed for the risk of transmission, and that would be part of your role if you're on OHS lead. And where warranted, appropriate post-exposure management is offered. Importantly, exposure outside of work also needs to be considered. So this is especially important if the potential exposure has occupational health healthcare implications rather. An example of that would be if you're a staff member and let's say your child has chickenpox. So it's certainly important. So that's not a workplace exposure, but because of your contact at home, you certainly would have to notify your workplace, and the workplace would have to make an assessment of what the risk is. Something that definitely needs to be considered. And occupational health and safety would involve IPAC leads at some point for this as well. So you want to be aware of that. And that's a good understanding of these policies is where this all benefits you in practice, is because as an IPAC lead, you often be contacted by occupational health and safety because they will want to know when the patient of concern, for example, was placed on additional precautions, what were the periods of not having isolation and potential exposure. So all this is again highlighting the collaborative nature of these two departments. And certainly it's something we want to make sure that you're aware of. And as part of the management, you want to make sure that you work collaboratively. One thing to keep in mind is that exclusion from work or restriction from work is not specific to the individual home where you're working. So when there's a restriction or exclusion that goes beyond, it goes to other healthcare settings or centers as well. Because obviously if you're exposed, you're not just putting the residents in the home at risk, but if you work other shifts elsewhere, or even in other high-risk settings, let's say you also work in a food premises and that the infection is putting people at risk in that setting, you want to make sure that that staff are aware of what the restrictions are. Additionally, occupational health and safety staff also need to notify those exposed or infected about prevention in general. So apart from obviously taking measures to prevent further exposure, you want to make sure that that information is shared beyond the facility, because those individuals, the staff members, when they do go home, they are potentially putting their loved ones at the risk and also the community. So you want to make sure that they're aware of overall preventative approaches to take when leaving the facility. One important aspect of work restrictive policies is that of those policies not being punitive. So it's very important that these policies are in place for really the good of everyone to prevent transmission. So you want to make sure that those policies are not going to be punitive. You want to make sure that you are encouraging reporting, that everyone is honest, and that those who do report are not being penalized, are not, in essence, being punished for doing the right thing. So that's certainly something you want to make sure that you cover. Another thing to keep in mind is that some of these diseases may be reportable just because of their significance. So what I'm referring to is public health reporting. So the medical officer of health may require that these infections are reported. Likewise, because obviously we're talking about occupational health and safety, there's that lens as well. So the Ministry of Labor, Training and Skill Development would need to be notified, as would the Workplace Safety and Insurance Board, and that's especially important, obviously, if the investigation reveals that the actual infection was indeed occupationally acquired. So that's certainly something to look at. And lastly, our last two sections, which I'll cover quickly, are counseling and records. So counseling refers to advising, and as IPAC leads, most of you are quite familiar with this. We advise people routinely on what precautions to initiate. Hopefully a lot of those individuals could make that determination based on the education we've provided, but there's certainly unique situations where we would advise. Counseling includes providing information on risk transmission and assessment, as well as discussing approaches to prevention, speaking about communicable diseases. Also, obviously, as mentioned, post-exposure prophylaxis. You certainly need to make sure that the consequences that result of this staff are aware of. And two concerns to raise with staff, or two concerns that are often raised by staff, and when they are looking for advice, our staff will also will often come to us asking how they will be affected and whether they will be bringing this infection home. So that's a concern we hear quite frequently. And another one is when healthcare workers are pregnant, there's often a concern there where you will get asked, am I okay to have this work assignment, for example? I have a I'm pregnant, will my unborn child be impacted? So that's certainly something to consider. Lastly, we have records and data management. So certainly not a fun topic for many of you, but certainly very important. So you want to make sure that you remain aware of this topic and are aware that this is a very important thing to cover. The key aspects are privacy legislation and keeping personal health information of healthcare workers private. So it's certainly important. Confidentiality, as most of you are aware from a patient perspective, is very important. But that certainly translates to staff as well. It is after all personal health information too. So you want to make sure that you keep that safe and that any records that are kept are stored in encrypted devices, whether it's tablets or laptops, and that those devices and the records themselves are secure. It's important that when communicating about personal health information, email is not used. So that's an important thing to keep in mind because it is not the most secure form of communication. So that's some of the information we did want to highlight. So these 6 components of OHS practice we covered are really just an overview. As with any field of practice, including IPAC, which a lot of you are learning, it's hard to capture all the unique, challenging, and occasionally kind of mundane things that you do in a day-to-day practice. But certainly it's hopefully given you a bit of an overview of what OHS programs involved. And now I will pass it on to my colleague, Lori, who's going to be discussing communicable diseases. As well, she's also going to touch on occupational health and safety program indicators.
Thanks so much, Dariusz, and welcome everybody. That was a comprehensive overview. So I'm going to run quickly through the next section on specific communicable diseases that you may encounter in your home with your residents. And before I do that, I just want to highlight a key point that Dariusz mentioned. And we talk about occupational health and safety and IPAC. We often think of it in the context of 2 different departments, but some of you in smaller facilities in your homes may be wearing multiple hats and doing both. But it's important to consider that occupational health and safety is a component of your IPAC program. It isn't a standalone on the side. And when you're looking at developing your IPAC program, please don't leave this section out. It's highly important. And especially when you're looking at FTE requirements. What motivates me and drives me every day in my job is really bridging that gap between occupational health and safety. It is a legislative requirement through the Health Protection and Promotion Act. So I won't go into any more detail about that. We're going to touch on a few different communicable diseases you may encounter in your home and know that many of them are reportable through that Health Protection and Promotion Act, such as TB, varicella, bloodborne infections, GI outbreaks in institutions, influenza, and what we saw most recently is diseases caused by novel coronavirus, such as COVID-19. So let's look at tuberculosis and why is that important? Why is it important to do pre-placement screening? It's important to get a baseline for your staff. In the event that they do have an exposure at work, you can determine if they were negative at pre-placement and then have a positive TB skin test post-exposure that occurred within that time frame and really helps for further decision making for that staff person. Pre-placement usually requires a 2-step TB skin test if your TB status is unknown for tuberculin skin testing, or if you've had a prior negative test. A single step is only required if you have documented results of a prior 2-step or a documented negative TB skin test within the last 12 months. Another resource I just want to highlight is your Canadian TB standards, along with the OHA protocols that we mentioned here. And I really encourage you to look at those and work closely with Occ Health and when it comes to TB with your, since it is reportable, with your local public health unit. Next, we'll look at varicella, and I'm sorry I'm skipping through these quite quickly, but again, with pre-placement, varicella immunity is important to know so that Again, these are all preventative measures. So if staff has an exposure, you know up front that they have immunity to varicella. And really what you're looking for is either documentation of 2 doses of varicella containing vaccine, or lab evidence of immunity or lab confirmation of disease. And really what I want to stress here, it's really important that only healthcare workers known to be immune to varicella may be assigned for care. And sorry about that. And especially with your pregnant healthcare workers that don't have immunity to varicella, it's important that they must not be assigned for care to residents with chickenpox or zoster or shingles. Your susceptible exposed healthcare workers, if they do have an exposure, they need to be excluded from work 10 days after the first exposure until 21 days after the last. And really important that when you're looking at your policies for this, this information can change over time for any of your communicable diseases. It's important to be following the most current recommendations. And if you're dealing with a staff person with acute disease, this is when Occupational Health and Safety and IPAC work closely together in terms of identifying contacts, such as your resident contacts. So let's go on to bloodborne infections. And I want to have some time for Q&A. So this is a very heavy topic, so I'm not going to go into a lot of detail for it. Really important that the one thing that you do want to screen for in terms of ensuring that staff have protection, if they're going to be exposed to blood or body fluids of patients, they have an occupational risk of acquiring infection with Hep B, Hep C, and HIV. Really important that Hep B immunization is offered for any of those employees, and that you have proof of immunity, which is testing with blood work for the antibody to the Hep B surface antigen. And this is the one thing I do want to stress. I've dealt with a lot of staff that have dealt with blood and body fluid exposures. It's extremely stressful. Your greatest risk is with Hep B, and if it is a positive source for Hep B, and having immunization really eases staff's minds. So don't forget about your support staff, such as housekeeping, your maintenance staff, linen, laundry, etc. People that take out the trash included. We've had injuries from sharps being improperly disposed of. And that's where I want to really talk about a sharps prevention program, a sharps injury prevention program, really essential. There's some key elements. One is to make sure you're using safety engineered needles according to the needle safety regulation, and that you're really keeping on top of those sharps containers, not just the type of container that they're puncture resistant and tamper proof and properly labeled and not overfilled, but they're really being properly placed and at the point of use. And I know this can be challenging in a home for your residents because it is their home, but for staff safety, they need to have access to these containers. They also need to activate that safety engineered device, which will also help reduce the risk. Another thing to consider is ensure your sharps containers are properly assembled, so all parts are snapped in securely, they're properly mounted, and they're properly stored and disposed of. So let's go on to enteric and respiratory pathogens, just on the last 2 slides here. And again, the one thing I want to stress with enterics, you don't have to screen pre-placement. And what's the biggest thing to say here? I'm trying to speed it up. I know. Dariusz talked about healthy workplace policies like staying home when you're sick. So if you have an enteric illness, respiratory illness, one thing that you want to really look at are your policies for sick time, and all staff should, if you can, be entitled to sick time for these diseases. I've had many staff come into work sick in the past. because they don't have coverage for sick time, and it will help reduce your risk. In terms of respiratory, this is where your immunization programs come in for influenza, for COVID-19. Important at pre-placement to do a lot of training and education in terms of the reasons for immunizations, how that can really help reduce transmission of respiratory viral infections to your highly vulnerable resident population. And then lastly, we're just going to look a little bit about evaluating an Occ Health program. Going to run through this really quickly, but looking at a few examples of indicators you may want to consider. Looking at rates of Sharps injuries, you really want to do that by looking at where they're occurring, maybe by profession, by your department, by the activity. And what do you do with that? You want to provide education. You're not just dealing with an injury on the spot and it gets reported and you're trying to prevent. But when you notice trends over time, it's really looking at those education initiatives. I did a lot of work with medical device reprocessing staff who wanted more information on Hep B immunizations, for example, a lot with housekeeping staff because the frontline staff were inappropriately disposing of Sharps. So looking at working with the managers on the units to educate their staff on proper disposal and the barriers to that. Hopefully the containers aren't overfilled. The next slide is just highlighting additional IPAC resources that are there for you. And this is through the Association for Professionals in Infection Control and Epidemiology. They're available there at a fee, but really good preparation, especially for those of you that are planning on writing your CIC in 3 years. Great resources for Occ Health. And now we'll turn it over to the Q&A.
Okay, thank you very much, Lori and Dariusz. And we have some questions. Maybe the first one I will go. It's I'm wondering about the procedure on some long-term care facilities have for tracking and screening ill staff and their return to work. Is this IPAC or do other people in the field these calls? Please explain the process. Dariusz, if you can take this one, please.
For sure. So definitely something that's concerning for IPAC staff, having staff in the facility with infectious diseases. But again, as we covered, because it's an occupational health focus, it's really the occupational health department that would be covering that and tracking it. And in terms of how the tracking is done, that is quite variable. Obviously, it depends on how resourced the long-term care home is, whether it's electronic or paper-based. But it's certainly something that would need to be tracked to make sure that you're able to monitor when individuals can return to work. And it also depends on the infectious disease to an extent. As you could imagine, based on what we discussed, there's some diseases that are reportable to the public health department. So some diseases may even require public health clearance, depending on what those are. Tuberculosis, for example, would be one disease. But yeah, so it would be quite variable. I don't know if Lori has anything to add from her vast experience.
In terms of tracking and screening, nice to have an electronic format and also looking at your policies in your facility. In terms of ill staff, some facilities actually contract out third-party providers in terms of return to work, and they do the follow-up. That's more short-term disability management.
Okay, thank you. And please continue to enter your questions in the pod, and if you have not done already, and we have some time to go over some next questions. And some of them we are responding online, as you can see. The next is the hand and foot mouth disease in the household is the restriction for staff to work.
I'm going to skip this one just because of time, but we can, our contact information will be at the end if you want to share contact us directly. We can respond to that for you.
Yeah, okay. Yeah, we can do that. as we need to do a lot of explanation. So please email us. The next one is varicella screening mandatory? What was the date or expected date? It is mandatory. I'm not sure what it means. Yeah, mandatory is yes, but the next part of the question I'm not clear. Dariusz, if you can take that one, please.
Yeah, I'm not clear of what the question is asking. Again, I think it's best for certain things, especially specific diseases or circumstances like the foot and mouth disease, just because there are so many variables, it's best that you reach us at the emails provided, so we could really take a good assessment of what the situation is, so you could advise you accordingly.
And just for mandatory, that terminology,
Mm-hmm.
With the OHA protocols, this is for Ontario hospitals through the the Hospital Act. And so, but they're recommended for other healthcare settings. So highly recommended. You want to ensure that your staff can work safely if you do have a case, say, of disseminated shingles with a resident in your home.
Okay, thank you. And the next one is about the Fixing Long-Term Care Home Act does not define that vaccinations are required for employees prior to employment. It basically says follow the best practices, what best practice document should we use. Yeah, obviously the act cannot encompass all the details of the activity and including the infection control. Dariusz, if you can direct to some of the documents and best practice guidelines and the requirements at the provincial level for those, please.
For sure. Yeah, we did cover that in one of the slides. So I mentioned the whole concept of due diligence and various regulations and guidelines that are out there and protocols. So even though the legislation may not clearly stipulate something, one thing in, I guess, legal frameworks is the idea that you still have to do the best you can, and you have to comply with what best practices, and that's key with a lot of aspects, whether it's OHS or IPAC. So if there was an issue with legislation, for example, the law would look at what is the best practice in the field. So you really have to reference things like NACI, PIDAC documents, and other guidance and protocols that specifically speak to various requirements or expectations based on evidence, best practice, professional opinion. So those are certainly things you would be able to review. In terms of specifics, it's really hard to have those accounted for legislation, like Boyce mentioned, just because things vary. So to pass an act or a regulation takes a lot of time, which is why they're often not very specific, and they rely on these additional non-legislative documents to guide day-to-day practice, because they are easier to change and amend based on circumstances like the pandemic. So.
And I'll just, yeah, Dariusz, thank you. You mentioned due diligence, really important with the Occupational Health and Safety Act. As an employer, you're doing everything in your power to protect the health and safety of workers. Offering immunizations before they start their first day on the job is really a key in case they have an exposure or in case they can bring something into the organization and expose your vulnerable resident population and your colleagues. A big part of your immunization program pre-placement is educating staff on the risks if you are to immunize and what that could mean for your own illness, for your family's illness, and for those of your resident population. So Canadian Immunization Guide, working with your public health units are good resources as a starting point.
Yeah, thank you. And also your resource and partner locally is your public health unit. Don't forget about, if you have any questions, consult with them. And they have lots of resources and can answer a lot of questions. And also newly established IPAC hubs in your area. And we have a couple of questions about the TB, about the validity of TB test, and pre-employment screen.
So tuberculosis, validity of the TB skin test?
Yeah.
Yeah, so I mean, there is another option for TB skin test instead of TB skin testing, but if you're going to be doing serial testing in your facility, so knowing that there might be certain populations, and for healthcare settings, the TB skin test would be the preferred choice. The biggest thing with validity is that you have a trained worker to do the TB skin test, so they're getting an appropriate intradermal injection with a bleb or a wheel, and that they're highly trained in reading it. So that would be my big takeaway for that one.
Yeah, thank you, Laurie. So it is not, there is no word skin, it says just TB test, so which includes the old two-step as well, I think.
Yeah,
And the
so
question, yeah.
tuberculin skin test is a TST, which is also called a TB skin test, yes.
Yeah. Okay, and we will take one more question. The new TB screening guideline has some few changes. We received document of local public health department. The PHO document from 2019 still different, has different recommendations. Is there plan to update PHO document in long-term care?
Yeah, so the changes were more for your screening of your resident population coming into a facility. That has changed. But in terms of information on TB screening, TB skin test screening, and follow-up for staff that may test positive, that really hasn't changed, but it is a 2022 document, so we can certainly provide that link in the chat. I can pop that in for you.
Okay, while you're doing that, I think we can wrap up today's webinar, and I would like to thank one more time Laurie and Dariusz for presenting. You can expect to receive the brief and anonymous survey for today's sessions and all the other sessions we did in the past few weeks. And please complete these to help our programming. And these orientation series are for IPAC leads in long-term care homes. And therefore, I ask you to complete this survey to improve our activity in the future. And lastly, to access last presentations and view confirmed upcoming sessions, please visit the PHO website and head to education and events, click the presentations, and you will see all the resources. And some of the sessions and the checklist already posted in our website, as it was mentioned earlier. And you can go and check. 2 of them is already there, 2 first sessions, and the next ones will be coming soon. Please check it out, and thank you one more time for your attendance, and have a wonderful day.